Assalamu alaikum wa rahmatullahi wa barakatuh. Our esteemed viewer, once again, welcome to your program Health Check, a program where I bring medical experts to give us medical advice regarding our health. Any ailments, any sorts of diseases, we have them to guide us and help us understand how to overcome them. And today with me is Dr. Beka Akaturinda. You're most welcome.
Thank you.
The topic of this discussion today is quite disturbing when it comes to its pronunciation, but doctor, the one that gave it to me, will help me on how to pronounce it. How is it called?
Dysmenorrhea.
Dysmenorrhea. That's how it is discussed. As you see down below, when the name is written, you wonder how it is read. But dysmenorrhea is the name and the topic of discussion today. What it is, that's the main reason he's here. How it affects, how it disturbs us, how to overcome it, how to prevent ourselves from being contracted with such a disease. That is the main reason we brought Dr. Beka Akaturinda. Straight to the question. What is dysmenorrhea?
Thank you. Thank you once again. Dysmenorrhea is a medical term for painful menstruation periods for women. So when a lady gets in menstruation periods, we expect her to get a slight discomfort, some slight little mild pain just.
Okay.
But now when it becomes more painful, now it is severe pain or moderate pain, there it qualifies to be called dysmenorrhea.
Okay.
So that's what dysmenorrhea is. It is usually due to the uterine contractions, because during periods, the lady's uterus contracts to shed off its walls for her to see the blood which comes out during the periods.
Okay.
So that process of the contraction of the uterus should cause slight discomfort in normal cases. Now, when it is causing pain, then it is qualified to be called dysmenorrhea. So that is dysmenorrhea for us.
Okay. Does it have types? From what you're saying, it's as if the term dysmenorrhea is what the layman understands as cramps.
Yes.
Okay, those painful cramps.
Yes.
Does it have any types?
Yeah, it has types. Type 1 and type 2. Or let me say, it has primary dysmenorrhea,
okay,
and secondary dysmenorrhea. Let me discuss first secondary dysmenorrhea for our viewers to understand what primary is when they come to it.
Okay. Because
we have primary dysmenorrhea and secondary dysmenorrhea. Now, for secondary dysmenorrhea is when the painful periods, okay, the painful menstruation period, the cramps, are caused by an underlying medical condition.
Oh.
I said, normally, when a lady gets in periods, her uterus is contracts and sheds off the uterine walls to cause the blood to come out. So, under normal circumstance, it should happen. She gets mild discomfort, and all is well.
Okay.
But now here we find that some person, a lady, can have a disease already in her reproductive parts, reproductive system.
Okay.
So as the uterus is contracting, the pain becomes intense, becomes worse. So this secondary dysmenorrhea is caused by medical conditions. The most commonest one of this secondary dysmenorrhea is due to what we call endometriosis.
Endometriosis. And
yes.
What is that?
Endometriosis is a condition whereby the lining of the inner uterine wall is on the outside of the uterus. The muscle or the tissues which are inside the uterus, which respond to hormones during menstruation, are also found outside the uterus. The uterus is like here, the muscles which are inside here are also outside here on the uterus.
Okay.
So when it comes to time for contractions, the inside part of the uterus will contract, and also this one here. So it causes now the pain.
Okay.
So a person feels more severe pain than the discomfort we talked about because of the
So it's now
abnormality.
beyond discomfort.
Yes, yes. Now pain, real pain. Because of the abnormality in the uterus, because of this disease called endometriosis.
Okay.
There's another common condition called the PIDs. These are pelvic.
That's abbreviation.
Yeah,
An abbreviation.
yeah. Pelvic inflammatory diseases.
Pelvic
Inflammatory diseases. Yes.
Mhm.
So when the person has diseases in the uterus, remember we said during menstruation, the uterus contracts. Now imagine uterus is contracting, yet it is already sick. So uterus is sick already, it has a disease, then it has to contract by force to cause the menstruation to happen. There, the pain we expect to be much. So now this is what we call secondary dysmenorrhea, caused by an underlying medical condition. Now, let's discuss now primary dysmenorrhea.
Yes.
Now, primary dysmenorrhea is where this painful menstruation period is not due to any other medical condition. A lady has no issue with her reproductive parts. The uterus is very fine, is normal. The fallopian tubes are all normal. She has no disease. She has no PID. She has no endometriosis. But still, when she gets in periods, it is very, very painful. So that is called the primary dysmenorrhea. Whereas secondary dysmenorrhea, we said, it is caused by an underlying medical condition in the reproductive parts, reproductive system.
Yes.
Now, this case for primary, there is no medical condition. It just happens on its own. Of course, we discuss as we go further, but here the person has no disease.
That is quite worrying.
Yes.
Someone has to be prepared for that pain every month.
Yes.
Our sisters are really in great danger, whoever suffers from this one. But doctor is going to help us understand how to overcome and how to maintain or to live with such pain. Doctor, now this takes me to having explained the types, the secondary and the primary ones. Now we need to know the symptoms. What are the common symptoms for one to understand that these are maybe cramps? I either need to go and see a medical doctor or I'd rather stay with my problem.
Yes. Like I said, under normal circumstances, a healthy lady, when there are few who go in menstruation periods and they don't feel anything, most of them have those discomfort, mild slight pains in the abdomen. Those are normal. Now, where it qualifies to be dysmenorrhea is when the pain is much. So the commonest symptom is lower abdominal pain. A lady feels pain in her lower abdomen, severe pain or moderate pain. Or let's call it pain which a person cannot bear. Pain which causes a person to be unable to do her work in the lower abdominal region.
Yes.
That is a characteristic or a symptom for dysmenorrhea. Then number two, the pain radiates to the hips and the lower back. So that is also a sign and a symptom for this dysmenorrhea.
Lower back and the hips.
Yes, yes. So meaning the pain begins from the lower abdominal pain, it radiates to the back and also to the hips. Yes. And also the thighs as well. Now, there are some people who get nausea and vomiting.
What's nausea? Nausea
is, in layman's language, the feeling to vomit. So, to explain it better, I can say nausea comes before vomiting. However, you can have nausea and don't vomit. Yes, it's also possible. But that nauseating, the person feels like vomiting, feels like not fine. Anything they eat, you feel like to vomit. Or even not eating anything, they feel like to vomit. That feeling is called the nausea and is one of the symptoms of this dysmenorrhea. And also vomiting itself. Some of them can vomit. Then others have dizziness. You feel like you want to fall down. They're not stable when they are standing. Others can also have headache. Yes. Now, there are other, which you call severe symptoms or symptoms of severe dysmenorrhea. Some of them even can faint. Yes. And they are rushed to hospital and they are hospitalized. They go on ward. They are admitted. they get fluids, they get drips. So those are the symptoms and signs of dysmenorrhea, ranging on the severity of it.
Doctor, let's right now talk about the prevalence and impact on the daily life of our sisters.
Yeah, true. In the beginning, you were saying it is a serious condition and our sisters will have challenges coping with it. Then you gave good news and you said, good enough, that's why you brought a doctor to explain to us how to go about it.
Yes.
Yes, dysmenorrhea 1 happens usually in the ladies who have had early menstruation or early onset of menstruation. This what am I trying to mean by this? Early onset means a person begins seeing her menstruation period by the age of 12. So that means she's most likely to have dysmenorrhea, to have painful periods. Then also, those who have heavy periods, most of them experience this dysmenorrhea. So, and there's another issue which I cannot undermine, the family history.
Oh.
Genetics now.
It can be genetically transferred to someone.
Yes. If a person's mother had dysmenorrhea, then it is most likely that she also might get dysmenorrhea, the painful menstruation period. So if a person's mother, a person's grandmother, in the lineage of the person, there is this condition, it's more likely that this person might also get. And also, we can also not forget smoking. Those who smoke, they are putting themselves at a high risk, at a great risk of having this dysmenorrhea. Because smoking has what you call nicotine, which goes and disrupts the hormones. Remember, perhaps I should mention this in the beginning, menstruation as a process is controlled by hormones.
Oh.
It is hormones which go and command the uterine walls. Now you contract because we have blood we have the walls to shed off. Maybe a second. One, to explain this further, any lady every month is expected to get pregnant.
Oh.
The uterus prepares for pregnancy.
Okay.
That's why it becomes thick and it prepares for fertilization to take place, and it bears the baby. But now, if fertilization doesn't take place, in other words, if a lady doesn't get pregnant, now there is no use of keeping this heavy uterus. It has to shed it off. So the hormones command it to contract and sheds off its walls. That's how menstruation happens.
Okay. So
when it is now painful than expected is when it qualifies to be dysmenorrhea. So those are the prevalence, those who have early menstruation periods, those who have heavy periods, those who smoke, family history. Then the impact now, the impact on our friends, the ladies, is that dysmenorrhea may disrupt your day-to-day activities.
Yes, due to this too much severe pain.
Too much severe pain. Because you can imagine a person is perhaps in a taxi going and the abdominal pain becomes intense, becomes much.
She can't even walk.
She cannot even walk. Assuming a person is digging and the pain is much and she collapses down.
Someone is in the office doing some work.
Doing some work and the pain becomes intense, becomes severe. Like I said, severe dysmenorrhea calls for hospitalization.
Yes.
So it means a person won't be working, will be in hospital. Then, of course, expenses. So it affects the daily lives if it is severe. That's why we're discussing it here, so as to see how to go about it.
Okay.
Yes.
Doctor, do you mind talking about the risk factors right now, having told us the impact it has to our sisters? Mind if you talk about the risk factors?
Yeah, absolutely, absolutely. Now, like we said, this dysmenorrhea has no cause. The primary dysmenorrhea has no cause. Because we say secondary is caused by those diseases. Now, this primary has no cause, but has risk factors. That's why now we say risk factors so that we can know which person is at high risk of developing this dysmenorrhea. So one, those who smoke. Smoking predisposes you to having dysmenorrhea or painful menstruation period. And also, those who have had menstruation period, the first menstruation period early in life, say 12 years and below, then they are at high risk of having this dysmenorrhea.
Okay.
Then also those whose mothers or whose lineage, family lineage, has a history of dysmenorrhea, they are at high risk, at a great risk of developing this dysmenorrhea because it runs in the families. We say it is hormonal in nature. So as the hormones control menstruation, now a challenge in hormonal balance will command the uterus in an unusual way, an abnormal way, and it causes severe pains. Like we said, there are those who have heavy periods. So those who have heavy periods, I mean heavy flow, it means there is a lot of uterine walls which were created. When they are shed off, most likely they may get this dysmenorrhea. So those factors predispose our ladies to having these painful periods. So anyone who has those factors is at great risk of having dysmenorrhea.
Okay.
Yes.
Thank you so much, Dr. Baker Akaturinda. Indeed, we are grateful, and I hope you are, our beloved viewer. This is the main reason we bring these experts to help us understand how to overcome certain issues or certain ailments in as far as affecting or disturbing our bodies is concerned. Just imagine some diseases or problems, you just can't get away with them, you just can't treat them because they are genetic. Some diseases you won't fight with anyone, you won't fight with your husband, you won't fight with your wife. You brought this and this, such a disease in the family because they are genetic. And these are some of the diseases that are genetic that you won't find with your husband or any of your relatives or any person. You won't blame anyone.
Yeah, true.
You won't blame the neighbor or your sister or your colleagues at school because you were born with it. How to live with it? This is the main reason we bring these people here. There is a story of one of our sisters who would like to share with us how actually she has the same problem. You said this is dysmenorrhea, right?
Yeah.
Yeah. So she's telling us how she managed to live with it, how it affected her daily life. A brief mention of the management and strategies that she used to overcome this problem. Let's have a look at it.
I felt pain, so my father brought me herbal medicine, then we mixed with hot water. After, then the pain went.
Okay, thank you so much. That is it from her.
Yeah,
now let's hear from the medical point of view.
Yes.
Talk about the management and treatment options of this problem.
Yeah, like she said, we have different types, different ways of managing or handling this dysmenorrhea.
Okay.
One, in accidents, there's what they call first aid. Here, I want to call it home remedies.
Okay.
I will not call it first aid because first aid is when a person has gotten an injury. But here, there's no injury. A person is normal, but she has gotten painful periods. So I want to term it home remedies. Dear viewer, if you are ready, before you rush to hospital, you as a person, you can first do something. So this is what we call home remedies. And among them is, you can have some hot water in a bottle, in a plastic bottle, and you try to pass it on the lower abdomen. The heat will help to relieve on the pain. Now, it helps to relieve on the muscles. When they are relaxed somehow, the pain is somehow reduced. So you can manage this at home by using the heat in a bottle, hot water in a bottle. You can also have a hot pad, get some pad and put in water. Then you can massage on the lower abdomen.
Okay.
For those who are married, their husbands can do if they are romantic. or if they have time. Those who are not, but they can do it themselves.
Okay.
Just massaging the lower abdomen using some hot water.
Okay.
It can help to relax the muscles and relieves the pain.
Okay.
Now, also we encourage to have enough rest, enough sleep. Usually, these hormonal disturbances result from stress. So when a person has not had enough sleep, it can really lead to the severity of the dysmenorrhea. So we advise our sisters, our mothers, our aunties, our friends, the ladies, to have enough sleep so as to relieve or to manage this dysmenorrhea.
They need to rest enough.
Yeah. Then also there's what you call relaxation tactics. One of it is meditation. Meditation is when you sit and you let off stress, you let off pressure. What you cannot handle in a daily life, let it not stress you too much. There are situations which are, I'm not meaning this disease specifically, but I'm meaning the lifestyle we're living in. The life challenges we have. Don't put too much mind on it, because once you are too much stressed, this increases this dysmenorrhea. Then also, there is what you call lifestyle changes. When a person knows, I have been smoking, and you've been having this dysmenorrhea, perhaps you stop the smoking. It can help you to also reduce on the pain. Because like we said, those who smoke has nicotine in it, which affects the hormones and causes the pain. So to help yourself, leave smoking, avoid smoking.
It now becomes a hormonal problem in case you do not stop smoking.
Yes. So leave smoking, it will help you. Then also we encourage exercises. When you do exercises, it makes the muscles relaxed. So there's what you call endorphins. Endorphins, when you do exercises, as the body is exercising, it releases what you call endorphins, which helps the muscles to be relaxed. So this helps now on the uterus to contract, let me say controllably, or in a good manner, let me use that term. And therefore, the pain is reduced. So that's the importance of exercises in the management of this dysmenorrhea. Also, I can't forget about food, diet. Yeah, very, very important.
How does that help?
Those who eat leaf vegetables, cabbage, dodo, nakati, in local language here, those greens, they help so much on this, on the hormones and the muscles, and therefore leads to controlled contraction of the uterus. High caffeine intake increases the problems now. Yeah.
So they should
avoid with caffeine.
Coffee.
Yeah, caffeine, yes. When you're taking coffee, don't take in large quantities, because it will also bring challenges.
Coffee is known for caffeine in it. Yeah,
that's why we advise to take in small quantities, not every time taking too much. And then also, you can't fail to mention supplements. Like vitamin E, omega-3, vitamin B6. Most of these things are found in fish, like you said, the greens, fruits. Yeah, those are very good for this condition, for managing it. So a person can do these things at home to manage this dysmenorrhea. Before you come to hospital, those are the things you can use. But also, the medication is when you come to hospital, which we can give you drugs. We give you drugs and you swallow.
For this dysmenorrhea that is very, very, very severe, beyond bearable, what treatment do you have for that?
We have what you call NSAIDs. NSAIDs, non-steroidal anti-inflammatory drugs. So when a person comes to hospital, we shall give these NSAIDs, these drugs, and the person becomes fine. Where it is too much, we can give IV fluids. We can put on bed what you call hospitalization. We admit and we manage. Now, what's the only thing to mention? In severe conditions of secondary dysmenorrhea, where we say it is caused by a medical condition, then we can do surgery. because we said the uterine walls, sometimes have similar tissues outside, so we remove them surgically, by surgery,
Okay.
and therefore controlling it.
Okay.
Yes.
Thank you so much, Dr. Baker Katurinda. Time is chasing us, but we can't just live like that without mentioning about the myths and facts about this problem.
Very important. In fact, this is one of the major reasons why I believe we should discuss this with our viewers, because there are a lot of myths going on outside there. One of the myths is that drinking cold water increases cramps.
Oh.
So ladies are discouraged from drinking water. They say when drink water, it will increase. But the fact is, no, water doesn't. When you drink water, it goes in the digestive system. It does not cross to the reproductive system.
Okay.
So that is a myth. Dear
It does
ladies,
not just go straight to the reproductive system.
It doesn't.
It has to be digested first.
Yes.
Okay.
Doesn't go as water, but as you drink it. So it is a myth. Please be guided. It does not. It's not a fact.
So, doctor, it's as if you are encouraging people to drink cold water now.
Of course, we also discourage drinking extremely cold water.
Okay.
But moderately cold water.
There are differences between cool and cold.
Yes.
Cold, it is worse.
So of course, normally we discourage very cold water.
Okay.
Yes, but it should not be used as to say that it increases. No, it doesn't. We're just trying to teach our viewers that reproductive system and digestive system are different systems,
yes.
very independent of each other. All right. Yes. Then also, others say when they do exercise, when a lady does exercise, it increases. That's also a myth. It's not true.
Okay.
Instead, exercises reduce on the pain.
Because you just said exercises relaxes the muscles.
Exactly.
Okay.
And therefore reducing it.
Yes.
So this is not true. It's a myth. Please, when you get pain during menstruation, come to hospital. We can manage this.
Okay. Yes. Thank you so much. We had a lot to discuss, and the myth story was still continuing, but unfortunately, time is saying you have to sign out. And indeed, we have to. This is the time that we are signed to with you, our viewer. Unfortunately, let me say we are signing out for now, but fortunately we still have more programs coming in. Just tune in MTA next time, same day, inshallah, and we won't miss a bite. I remain your host, Namba Ali Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.